How many of you will nod for a yes in response to the next two questions he asked? First, how many of you have a tendency to take a paracetamol when you experience dizziness, fever, or a headache? Second, how many of you use a combination of levocetirizine for cough and cold symptoms? Okay, those were two straightforward questions. Some of us may not be able to relate as most people are only familiar with the colors of the medicine they take. I hope you will agree that modern medicine can only provide you with either a box of drugs that have a nauseating odor or an appointment with a scalpel and scissors, which means surgery. There is no in-between solution. However, has it always been like this? At a time when we claim to have been one of the oldest and most advanced civilizations, how could we have relied solely on these practices? To your surprise, even though we had all the technology for modern surgery, our ancestors focused on curing illnesses rather than suppressing them, which is different from the modern Western medical approach. This is where traditional medicine finds its well-deserved place. To your surprise, even though we had all the technology for modern surgery, our ancestors focused on curing illnesses rather than suppressing them, which is different from the modern Western medical approach. This is where traditional medicine finds its well-deserved place. But how did we get here? To understand this, join me on this enlightening journey. Hi and welcome to TFIPost. I'm your host Atul Mishra. Let's begin. There is no denying that allopathy is still an evolving science, and as a result, much of the therapy is done on a trial and error basis. If the trial is successful, the therapy is adopted, and if not, a new one is developed. In addition, allopathic practices focus solely on treating the symptom and affected area rather than the entire body. This is also evident in the use of antibiotics. How many of you have been advised by allopathic medical professionals to change your antibiotic regimen because the bacteria you are trying to fight have evolved and become resistant to that particular drug? This is what allopathy has been doing over the years. Medicines are a lifesaver when your body is unable to fend off germs or is unable to destroy them promptly. When we fall ill and nothing seems to help our bodies feel better, medicines are our last resort. At some point in our lives, we all rely on them without being aware of the numerous drawbacks of allopathic medicine, such as only focusing on the affected area and never on overall health. Also, research suggests that allopathic methods often destroy beneficial bacteria and suppress diseases rather than curing them. Additionally, allopathic medicines remove the harmful germs in a way that requires a longer course of treatment. Another issue with this type of therapy is that unlike homeopathy and AYURVED, which use natural products to prepare medicines, allopathy relies on refined and synthetic chemicals for its medicines. Allopathic drugs are often prescribed based on the visible symptoms and not the underlying causes. The needs of different bodies are frequently disregarded by doctors, and the focus is on providing quick but temporary solution. That's where integrative medicine therapy comes in. As people become more informed about the limitations of allopathic medicine, they are turning to integrative medicine for support. So let me explain what integrative medicine is. While allopathy focuses more on symptom-based treatment, integrative medicine takes a healing-oriented approach. Unlike allopathy, it considers the whole person, including all aspects of their body, mind, and spirit, as well as their lifestyle. Dr. Kallol Guha has extensive experience in the field of integrative medicine and has shared valuable insights that can assist us in treating ourselves without relying solely on allopathic methods. Integrative medicine aims to incorporate the best practices of historical medical solutions. While some intellectuals may consider it pseudoscience or supernatural, practitioners don't aim to make their patients frequent visitors and instead focus on complete healing. It is through integrative medicine that the term reversible has become an acceptable concept in the field of medicine and diseases. Integrative medicine provides an evidence-based approach that combines all existing therapies. It synchronizes allopathic, Ayurveda, yoga, and naturopathy under one roof. This unique blend brings a balance of body, mind, and spirit, creating an ideal living space for an individual for a perfect health of both body and mind. The concept of integrative medicine gained popularity because it emphasizes the need to examine the whole person, including analysis of physical, nutritional, environmental, emotional, social, spiritual, and lifestyle values. The treatment often includes preventive healthcare and lifestyle modification. Integrative medicine can be divided in several aspects. Ayurveda. The roots of Ayurveda go deep into the Sanatani civilization dating back to the Vedic era. Most of the practices that are being followed today find mention in both the Rig and the Atharva Veda. The therapy process involves multiple steps, beginning with internal purification and a change in diet and lifestyle, ultimately working on Prakriti and the life force doshas. Ayurveda is practiced along with yoga. Yoga is a 5,000-year-old body of knowledge that originated in India with the contribution of Rishi Munis. Yoga is a straightforward technique for turning around the typical outward flow of energy and consciousness so that the mind develops into a dynamic center of direct perception, independent of the senses, proneness to error, and capable of truly perceiving reality. When Ayurveda and Yoga come together, wonders can be done in many life-threatening ailments, ranging from anxiety, asthma, arthritis, rheumatoid arthritis, digestive problems, eczema, high blood pressure, and high cholesterol levels. Naturopathy is known as nature's cure, as nature is itself a medical system and was a way of life in previous times. It is a subtle as well as simple art and science of pure living, with the base belief in nature's healing effect. Therefore, it is a drugless system with more physical or manipulative therapeutic treatments. It is used in different ailments where allopathy surrenders, such as autism, asthma, chronic muscle pain, allergies, and arthritis. Acupuncture, a term coined in the late 17th century, actually originated in the time of the Indus Valley civilization in India during the Stone Age. It later traveled from India to Nepal and China. In India, references to Vedhan or Vyadhan indicate that the term Suchi Shastra means acupuncture and Suchi Tod means to prick or insert a needle. The therapy has been developed in such a way that in many Asian countries, major surgeries are carried out using acupuncture to alleviate pain. It is also used for many conditions including insomnia, depression, smoking, and being overweight. Homeopathy, as known in Indian households, is a therapy that works slowly but treats the root of any ailments. It is commonly used in the treatment of severe allergies, migraines, depression, chronic fatigue syndrome, rheumatoid arthritis, irritable bowel syndrome, chronic leg ulcers, frequent colds and coughs, among others. Osteopathy, another alternative medical theory, is based on the principle that the well-being of an individual depends on their bones, muscles, ligaments, and connective tissues functioning smoothly together. It works by detecting, treating, and preventing health problems by moving, stretching, and massaging a person's muscles and joints. Rare complications like spinal malfunctions could be treated with osteopathy. Next is chiropractic, a form of alternative medicine concerned with the diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system, especially of the spine. In this, the practitioner focuses on the well-being and proper functioning of the main parts of the human body, such as the skeleton, muscles, and nerves. Practitioners believe that with adjustments to these structure, health can be maintained and manipulated. It is commonly used in correcting alignment-related issues. Approaching traditional or integrative medicine, the doctor turns into a healer, which gives them solace as well. Popping a painkiller every time there is a headache won't solve the issue until the underlying cause is treated. This is what integrated medicine does. While allopathy doesn't assess the pros and cons, practitioners in integrated medicine fully focus on every aspect, thus providing the best for the patient. We mentioned about Dr. Kallol Guha, who happens to be the CEO and founder of St. James School of Medicine, based in Chicago, US. He is one ardent advocate of integrative medicine, and he makes some really good videos. So here's our suggestion. Do yourself a favor and watch Dr. Guha's videos. You'll end up learning a lot of things about your own body that I'm sure you do not know about. Thank you.